Sorry, just to try to connect to my
No worries. No worries.
Can you see the presentation?
Yes, that looks perfect.
Okay. However, okay. Good afternoon, everybody, and welcome to this presentation. I'm Fernando Maravilla. I am a clinical educator in point-of-care ultrasound, and I work for Econus. This presentation offers a basic training on the use of Kosmos in the obstetric exam, and it is intended for informational purposes only. It provides a basic understanding of the obstetric ultrasound exam, and it doesn't replace formal training provided by certified organizations.
Okay.
So the goal of this online training is to discuss tissue echo characteristics, to recognize the head, femur, and abdomen of the fetus.
Rennie, can you please mute your microphone?
Yes. Thanks.
Thank you, Fernando.
No, thank you to you. Thank you. Sorry, just to say the goal of this online training is to discuss tissue echo characteristics, to recognize the head, femur, and abdomen of the fetus, to learn how to optimize the ultrasound image, to provide an introduction to the scanning protocol, learn how to perform basic obstetric measurements related to the second trimester, and finally, to answer your questions. So let's start with tissue echo characteristics. As you know, the ultrasound image is created when ultrasound waves travel through tissue and are reflected to the probe. The reflected wave is known as echo. Received echoes are displayed on the screen in shades of gray. So the stronger the echo, the brighter the tissue appears on the screen. And the weaker the echo, the darker the tissue will appear on the screen. Tissue echo characteristics are described in terms of brightness or echogenicity. So, echogenicity is the ability of tissues to reflect ultrasound. There are 4 levels of echogenicity. First of all, hyperechoic, where the tissue appears brighter compared to the surrounding tissue. Hypoechoic, where tissue appears less bright. anechoic, where the structure appears with no echoes and therefore is displayed as a black area on the screen, and azoechoic, when the image shows tissues with the same light intensity. So, as discussed before, strong echoes produce white, bright images or hyperechoic images. So bones reflect strong echoes, and therefore they appear as a white structure. In this sagittal and transverse view, the fetal skull bone appears as a bright white structure. And in this image, the fetal femur also appears as a bright white structure. As we know, weak echoes appear as dark areas, anechoic areas on the screen. So fluids in the body, like amniotic fluid, blood, or urine, reflect echoes with very low intensity, and therefore they appear like black areas on the screen, anechoic areas on the screen. In this first image, the amniotic fluid appears as a black structure. And in this image, the blood in the fetal heart appears as a black structure too. Regarding soft tissues, as discussed before, they are displayed in shades of gray. In this image, the uterus appears with different shades of gray. Let's now discuss the image optimization technique. In Cosmos, the most used buttons to optimize the image are depth and gain. We need to optimize the scanning depth by centering the region of interest on the screen. Here is an example of depth optimization related to the carotid artery. In this first image, the scanning depth is too deep regarding the artery. In the second image, the depth is too shallow. And in the last image, the scanning depth is correctly optimized because the region of interest is centered on the screen. It is important to keep in mind that sound waves become weaker as they travel deeper into the body. As a result, these waves lose intensity, and therefore they return less information to the probe. So gain helps us to compensate for weaker ultrasound waves. We optimize the image gain by having a balanced brightness between the near field and the far field of the image. Here is an example about a good gain optimization related to the carotid artery. In the first image, the gain is too low, it's too dark. In the second image, gain is too high. And in the last image, the gain is well balanced. Bear in mind that we need to use gel because it helps to eliminate the air gap between the probe and the patient's skin. Gel facilitates the transmission and reception of the ultrasound wave, and therefore, gel helps us to achieve optimal image optimization. Let's now talk about the basic setup for the obstetric ultrasound exam. Here is a basic guide on patient positioning for the exam. First of all, the patient should lie on her back. In late pregnancy, the patient can be placed on her side for greater comfort, which also helps to prevent the compression of the vena cava. And up to 13 or 14 weeks of pregnancy, a full patient bladder helps to achieve a better ultrasound window. Remember that the probe orientation marker, the orange dot on the probe, is linked to the orange icon on the image. And it helps us to get the sagittal and transverse view. So then, to get a sagittal view, the probe orientation marker should be oriented toward the mother's head. And to get a transverse view, the probe orientation marker should be oriented toward the mother's right side. This is an example about the sagittal and transverse view related to a non-gravid uterus. In this first image, the uterus appears in sagittal view. And the anatomical landmarks in this view are the uterus, cervix, vagina, and the endometrial stripe, which appears as a hyperechoic line, and then the bladder. In the second image, we have the same uterus, but this time in transverse view. A detailed explanation of the scanning protocol and fetal positions is beyond the scope of this presentation. The following slides are only intended to provide an introduction to these topics for novice users. Regarding the scanning protocol, the sagittal and transverse planes are used to scan the mother and fetus. Bear in mind that during the second trimester, the fetus can be in many different positions, including head down or up, or facing the mother's back or front, and this position will shift frequently. So the ultrasound exam starts by defining the position and orientation of the fetus. As we know, fetal position refers to the orientation of a fetus within the uterus, describes how the baby is situated in relation to the mother's body, and particularly describes the direction the baby's head and spine are facing. Regarding the scanning technique, basically the ultrasound exam starts by positioning the probe above the pubic symphysis in transverse or sagittal view. Then the probe must be maneuvered to define the position of the fetus, which can be cephalic, bridge, or transverse. And finally, to determine the position of the fetus spine. In the following slides, we will assume that the longitudinal axis of the fetus is parallel to the longitudinal axis of the mother. Let's start with this cephalic position where the fetal's head is facing the mother's right side. By scanning the fetal abdomen in transverse view, it will be possible to visualize the position of the fetal spine. So in this cephalic position, because the fetus head is turned to the mother's right side, the fetus spine will appear on the right side of the ultrasound image. The stomach and portal vein are also part of the anatomical landmarks in this abdominal view. In this cephalic position, where the fetal's head is turned to the mother's left side, the fetal spine is displayed on the left side of the ultrasound image. In this cephalic position, where the fetal's head is turned to the mother's back, the fetal spine is displayed on the top of the ultrasound image. In this bridge position, where the fetal's head is turned to the mother's right side, then the fetal spine is displayed on the right side of the ultrasound image. In this bridge position, where the fetal's head is turned to the mother's left side, then the fetal spine is displayed on the left side of the ultrasound image. And finally, in this bridge position, where the fetal's head is turned to the mother's front, then the fetal spine is displayed on the bottom of the ultrasound image. Let's now see how to perform basic obstetric measurements. In the next slide, we will see how to measure the biparietal diameter and fetal head circumference, the abdominal circumference, and the femur length. As you know, these measurements are used to calculate fetal age and to estimate delivery date. The biparietal diameter is measured in transverse view of the fetal head at the level of the thalami and cavium septi pellucidi. This measurement is performed from the outer wall of the proximal skull to the inner wall of the distal skull. This ultrasound image shows the measurement of the biparietal diameter. Regarding the fetal head circumference, we use the same anatomical landmarks as for the biparietal diameter. The circumference of the fetal head is measured in transverse view using the ellipse function. And the measure is performed at the outer surface of the fetal skull. The abdominal circumference is measured in transverse view of the fetal abdomen at the level of the spine, stomach, and portal vein. It is measured by using the ellipse function at the outer surface of the fetus skin. The femur length is measured in sagittal view along the longest axis of the ossified diaphysis. So then it is only needed to measure the bright white line on the image. In other words, we exclude the femoral head represented by the dark circle on the image. Regarding fetal heart rate, it must be measured with the M mode function. So remember that the M mode describes the motion of a single 2D slice in the time scale. To do that, the M mode cursor is positioned and activated on the fetal heart. On the M mode waveform, measure the time interval between two consecutive peaks or valleys. This time interval is known as the RR interval. And her rate is obtained by dividing 60 seconds with the RR interval. As you know, the normal fetal heart rate typically ranges from 1100 to 1600 beats per minute. However, this rate is higher in early pregnancy, reaching an average of around 1700 beats per minute. The next video shows how to optimize the image and perform measurements. This tutorial was created using images of an adult kidney and heart. Please note that it was not possible to create this tutorial using images from a pregnant woman. So this video tutorial, demonstrates how to optimize depth and gain, perform distance and circumference measurements, perform M-mode measurements for heart rate assessment, make annotations, and record images and videos. So first select the right preset, in this case OB. Then click on the depth button to optimize the scanning depth to get the region of interest centered on the screen. Click on the gain button to have a balanced gain between the near and far field of the image. To start doing measurements, click on the freeze button here and use the CineLoop function to select the right image. To do it, slide the CineLoop button until you find the desired image. Then zoom in on the image by using two fingers on the tablet. Then click on the distance button to start measurements. Position the calipers. And the result appears on the top of the screen. You can perform additional measurements. Once the measurement is completed, click on the text button to add annotation. Then you can position the annotation wherever you want. and then click on the marker button to indicate the region of interest. Again, you can position the arrow wherever you want. Once you finish this step, then you can take a picture with this button here. You can delete the measurements and text with these two buttons. After that, click on the area button to start doing circumference measurements. Optimize the circumference size by using the 4 calipers available on the circumference function. The result appears on top of the screen. Then make annotations and use a marker to point out the region of interest. And finally, take a photo. Click on this button to record a video at any time during the ultrasound exam. Regarding heart rate assessment with M-mode, once you get a view from the heart, click on the M-mode button. Position the M-mode line over the heart. Click on the update button to trigger the M-mode. Freeze the image, and as before, use the cine loop to select the desired image. Then click on the distance time button to start measuring the time interval. On the waveform, measure the time interval between 2 consecutive peaks. Time interval is displayed on top of the screen here. So then make annotations and take a photo. For image review, click on this button to visualize recorded videos and images. So scroll through the recorded images on this area. At this point, you have the choice to continue doing more images and measurements or close the exam file. To end the exam, click on the complete button here, and then click on the export button to transfer your images to a PAX or USB stick. Then to review, once the exam is completed, it is available in the exam button where with all the exams, patient exams too. Any questions?
Thank you for the presentation, Fernando.
You're very welcome. I hope this meets your expectation. I know that you were expecting to have the possibility for people to use correctly the Kosmos.
Yeah, since we have it integrated in our system, there's a different workflow how they use it, but this was really helpful. I want to see if
Sorry.
there's
Just
any
to put
community. Sure.
Sorry, just to put. Sorry about that. I don't know if you can see my image or not. Yeah, I can see that. Sorry about that. Okay.
Oh yeah, no, we can see you.
Okay, sorry. Yeah, so
Oh, good.
now I am used to work with Google Meet, so I'm a little bit lost with Zoom. Sorry about that.
No, don't worry. I have the same with Google Meets. So,
Yeah, any questions? Yep.
Yeah, I want to see if there's any questions from the community members. I see we have Karima here. I think that's for Lena who's joining. Kayla, Elsa, Melissa, Rexon. I know you always have questions.
Hey, good afternoon, everyone.
Good afternoon.
It's not a question, but I just want to appreciate how you explain everything. It's very helpful to me because I've been doing this before, like online courses, and I get more ideas of how to go about the ultrasound. So it's very helpful. So I just want to thank you for everything.
Oh, you're very welcome. By the way, I will share this the presentation and of course the video, so you will have it for any novice people that wants to work with Kosmos.
Excellent. Yeah, for the training, we usually put it on our private YouTube, so only the attendees get a link and they can rewatch it if they want to revisit or, have some more time to think about it. Want to see again, any more questions from anyone? Brian, Aline? Okay. Otherwise, I would suggest if you end up having questions and neither I or Rennie can answer them or Dr. McDavid, we will reach out to you, Fernando, if we get those questions. But I think this was a really good introduction.
Just to comment, it was a really, really wonderful presentation. Very, very informative. And I like that you had step-by-step on how to use the Cosmos. So that was really helpful.
Thank you so much.
Thank you so much.
Great to hear. Thank you to you.
Okay, I think if there are no more questions, you can